I mean, death is something that affects everybody at some stage or other, and it's going to affect everybody in the organisation. And I think it's good for staff morale, it's good business sense to have a policy like that.
We were just talking and it was coming to our attention. We had people coming to us just with general inquiries, you know, how much time off, and also just to talk about bereavement itself.
No matter, you know, how hard you are or how much you try and detach yourself from a bereavement, it does affect your work.
In a survey that was done by ICTU, they said that 62% of people believe that bereavement could lead to health and safety issues in the workplace. So it is something that is very important to look at and to make sure that it is considered in the risk assessments, that a risk assessment is done on this issue of bereavement in the workplace.
Well, we would have incidents, particularly on that N11, severe and horrific even traffic accidents. People who have to go to those scenes to help them, and guidelines in any aspect, no matter what format they come in, it does help those people, and it helps me to look after those people that I'm working with.
We hope to achieve with the policy was with supporting the person who is grieving at the time and knowing that management is there behind them. You can have a proactive approach for the benefit of the employee and actually make sure that they come back to the work maybe even faster, and therefore you're reducing maybe sick leave that might need to be taken.
We decided we didn't want to do something piecemeal. You know, we wanted something that was a bit more kind of, I don't know, holistic, I suppose, and a holistic approach to it. So we approached management with our suggestion that we should have an actual policy that was kind of would incorporate maybe guidelines to grief as well as the actual kind of policy itself, and they were very supportive. It
was done with the consent of management, with the consent of unions, and with the consent of the workers as well.
Best part of anyone developing a bereavement policy or even the guidelines for bereavement would be to get involvement from all sources. I think that's what we've learned on our working committee.
Get people on board who have experienced grief, listen to how they would have liked to have been treated. Maybe they were treated very, very well at the time, but just to take on board and bring it down to a human level rather than a circular level or managerial level. Just bring it down to the basic needs of the person as an employee, and think not just as an employee but as a person.
We wanted it to be inclusive. We wanted representatives from different parts of the organisation. We wanted to kind of, we wanted a gender balance. We wanted people from indoor and outdoor staff. Our organisation is quite big, so we wanted representatives from different areas of the organisation, and we managed to do that. I think we had about 8 people on the working group. So we set that up, and we actually used the Developing a Bereavement Policy resource document that you produce in the Irish Hospice Foundation, and that was our template for starting it off. Really good feedback actually from people, and you know, it's quite touching sometimes when people will come up to you and say, you know, it's great that we got this sympathy card from you, or I really appreciated that my entitlements were written down somewhere, I was able to sort of get hold of them. The policy has been used not just by people who are bereaved but also by supervisors and managers who might want a little bit of guidance on how to handle a bereavement around a member of their staff. So yeah, I've had lots of positive.
It has benefited all. It's brought more clarity to the whole area of bereavement, not just in terms of leave, which HR would deal with, but also with the personal grief that can be attached to a bereavement.
Well, to me personally, I found that the support that the policy gave me when I was bereaved on my immediate return was very noticeable from all levels of staff, in particular from the staff support officers who, you know, immediately greeted me with a sympathy card, and just I was aware of the change because my father had died about 8 years before and there wasn't a policy at the time, so I did notice a marked difference.
The guidelines have been a great help to me as a supervisor to know how to maybe approach people and approach workmates, and to get involved and to understand maybe where they're coming from.
Because I suppose the attention was given at the outset, it has been a great success, and something that we're very, very proud of and what we've achieved by it.